Okay, welcome back. We're concentrating on digging into the facts, into the science and the research. Let's talk to Republican Brad Wenstrup of House Ways and Means. He's actually a doctor. Great to see you, doctor. You're now on the phone with us.
I am. Yeah, good to be with you one way or the other, right?
Totally understand it. We're in a brand new world here. Okay, we're geeky. You know how China is now trying to blame the U.S. military for somehow cooking up the coronavirus and being responsible for it? There's no evidence of that. We're going to show the viewer a global heat map developed by the Global Virologists Association. It's an epidemiologist. Let's show that map. It's a preeminent virologist. Economist Edward Denny flagged this. It shows the intensity of the wave of the crisis coming out of China. If it was in a granular detail, you would see that China really was a hotspot. The intensity of the red shows that it did start earlier than China reported. Your reaction to this story?
Well, I think I've seen that map before, and I've seen that hotspot, and I understand it. But them trying to say that it was the United States, just typical of a nation like China, a nation like Russia. If anyone of your viewers have seen the documentary on Chernobyl, you understand how a communist-type system works, and it's not a lie if they think it benefits the state. So that's what we're getting. But in the meantime, of course, here we are doing everything we can to be factual with the American people, to let them know what is going on. And I think today with the president's press conference that we had an opportunity to see the brains and compassion of the people of this country as we come forward and try and make sure that we maintain the health of American citizens as best we possibly can.
The temperature and latitude has a link to the spread. The virus may diminish in coming months. That's what this group of virologists said. It could come back in fall and winter. Finding vaccines, finding cures, testing is big. I mean, China has a long history of viruses. So for them to blame the military here, it's kind of out of line, right?
Well, it's very much out of line. But again, it's just typical of how they operate. We know who we are, and look, if you're going to have a pandemic, there's no other country in the world I'd rather be in than the United States of America. And, you know, you get a new virus, you have to develop new tests. You know, we have a lot of agencies in place, but they come with regulations. Today we unleashed a lot of those. We're engaging with the private sector, which is allowing us to get more tests out sooner.
Okay.
And I think that we've had great conversations with the American people.
Congressman, let's listen to Dr. Oz. He gave us a really kind of a spooky anecdote. Let's listen to what Dr. Oz told us last night. Let's listen.
Yeah, I interviewed someone on my show today who was infected more than a month ago in Japan. And, you know, he got better from his infection, had classic signs, and he's still spilling virus particles from his nose, so he's still in isolation.
For how long?
Well, he's been more than a month, but we don't know. Again, the Lancet article is arguing it could be 37 days.
Wow. 37 days that person was contagious, but no symptoms for 5 weeks. This virus is stronger. It lives outside the host for possibly basically on surfaces for maybe 3 days and maybe in the air for 3 hours. It's a scary virus.
Oh, there's no doubt about it. And with any virus, it can shed for some time. And some viruses live within our body and then shed from time to time and can be spread at that time. Just for example, like a cold sore, that's a virus that can intermittently start to shed. And so I think he makes a good point, but this is the whole point of studying the science. And you know, when we do prevention, like we're seeing with all these shutdowns of games and events and making sure we educate the American people on what they should be doing, you never get credit for what you prevent because no one seems to know. So as we restricted travel, we can never measure how many cases didn't occur because of this. So at the same time, I think it's great that America is taking every precaution, educating the American people on the idea of containment and what we're trying to do to lower the curve so that we don't have a spike in deaths and then drop off. We want to keep people as healthy as we can, reduce the number of deaths, and ride this out. And
there's talk of an executive order that, you know, get us off of the China supply of drugs. 80% of antibiotics and the products, the chemicals there, are come out of China. You know, make it elsewhere, move that supply chain elsewhere. Congressman Wenstrup, thanks for joining us via Skype or via the phone. Really appreciate it.
Yeah, thanks. You hit on a key point there at the end with supply chain. Thanks for bringing that up.
Well, you'll come back on. Great to see you, my friend.